Hey, well, Trev here, and I'm back with Lloyd again, Dr. Lloyd Clarke. And so these are some of this is probably a more rapid fire question time. So look, I mean, I lost 20 kilos first month, 15 the next, another 10 the next, and I'm back on program now. So I'm over 40 kilo loss, pushing through towards 50, can't wait. But one question people, often will say is, man, if you're losing weight that fast, it can't be good for you.
So doctors in general have concern about people who lose weight without trying. And if you're older, like 50 plus, and you're losing weight without trying, that's a problem, especially if it's despite eating a large amount of calories. However, if you're losing weight in a program such as this, it's not dangerous to lose that kind of volume of weight in that time course. Look at the size of you. You're not a small man. You can afford to be a little kilograms less.
Yeah, and I'm going to keep pushing that and knocking on for the next bit. One of the things about the program that does appeal for some, but not for others, is exercise, right? So the advice that the mentors would give somebody doing the program would be not to exercise while on program. What's the thinking around that?
I'm going to tell you that in counseling people in my clinical practice on how to lose weight, you can attribute 80% of somebody's weight loss to dietary changes. 20% of their weight loss is due to an exercise or activity change. What I'm saying is, if somebody starts working out in the gym and really pushing it hard, they might lose some kilograms, they might succeed in weight loss, they might tone up, but to really lose effective weight, if you're your size, you can't work hard enough to lose 2 kilograms a day. It's just impossible. The most successful part of weight loss is through restriction, and sensible restrictions, but replacement with good nutrients. And that's why the program is multifaceted, and that's one of the success stories about it is your exercise, while it is helpful to be active, and I'm talking about a 30-minute walk a day is active, and you don't have to be burning the tons of miles or kilometers in your walk, but just being active is good. But if you think that you're going to go out and have the energy to work out while you're on this much of a restricted diet, I don't think you will. It's just not enough calories in the diet.
And I found that. So I found my first month, and particularly in that first week, I was like tired. Maybe day 3 or 4 in, I was like, I'm going to bed, I'm had it. And it was like 8 o'clock at night.
Yeah.
And I did very little exercise the first month, maybe walking 2 or 3 days a week. But then my second month, I was down like 25 kilos, and I'm like, man, I want to walk, I want to get out and do this, and every day I was exercising, so things kind of changed for me as I went through the program. Okay, now on the program, a lot of people come to their mentor with health issues. What are the sort of conditions that, if I've got, I don't know, diabetes or heart disease or hypertension, should I talk about that stuff, the program, with my GP or with my physician before I start?
Great question. If you have diabetes, high blood pressure, heart disease, or any other medication that requires you to take pills on a daily basis, you should consult your physician before you start any type of a program, be it a weight program like exercising or any nutrition-based program. Most physicians, when they see this, they'll see the brand name, they'll say, doesn't look harmful. You can take the product's verification for the word that it is, and you can take my trust if you want to, or you can research it yourself on Google. But there's nothing that's bad in the program that you should not take if you have hypertension, apart from one of the supplements has some caffeine in it. So that would be a condition where you would want to check with your physician. Maybe check your blood pressure before you start the medication, the program, and then check it after you've been on it. Does your blood pressure go down? I can guarantee if you lose weight, your blood pressure will go down. In fact, it'll go down so much that I believe your blood pressure is now normal and you don't need medication anymore.
Yeah, absolutely. So my blood pressure was up, and now the last test I had, I was like 120 over 80. I think if that's like a teenage blood pressure.
Yeah.
So that was awesome for me. Stay tuned, whānau, because we're going to come back with some more questions, a little bit trickier ones for Dr. Lloyd Clarke. Mō te ora.